Hello, everyone. When was the last time you had an exam with your dentist? Has it been more than 6 months or maybe more than 12 months? If so, it's probably time to make your next appointment for a checkup. Your smile is one of the first things people notice about you. Did you know that 50% of Americans by the age of 30 will develop periodontal disease? Periodontal disease is an infection of the tissues that hold your teeth in place. And when this is left untreated, teeth can eventually fall out on their own. Your mouth is the entry point to your digestive and respiratory tract, and bacteria in your mouth can also make its way to those tracts. An article by Robert Prate written in 2012 states that a type of bacteria in your mouth known as Streptococcus gordoni can even lead to blood clots and serious heart problems if it enters your bloodstream. Oral health can also affect mental, physical, and emotional health. And in order for you to maintain your overall health, you should be paying a visit to your dentist every 6 months. A textbook for dental hygienists called Periodontal Diseases, a clinician's guide published in 2012 by James Monaco, describes the mouth as a microbial ecosystem. The following are a few, but not all, examples of areas where microbes are present: the teeth, tonsils, tongue, hard and soft palate, gums, and lips. Poor dental health is linked to diseases such as endocarditis, cardiovascular disease, pregnancy and birth complications, and even pneumonia. Oral cancer is commonly found by dentists, and not going to the dentist can leave oral cancer undiscovered. Here's another problem. Periodontal disease leads to tooth loss. This can lead to depression and anxiety about the fear of smiling, job interviews, or even just interacting with others. I currently work as a registered dental assistant, and I cannot tell you how many people I have seen that say they are insecure about their smile. Once people lose their teeth, dentures and implants are typically the only options left. And unless you have $5,000 per tooth for implants, dentures won't be the same as natural teeth. Dentures can lead to trouble eating, malnourishment, and bone loss. Making sure you go to the dentist every 6 months is the solution to many of these problems, and I'll explain why. If people were to go to the dentist every 6 months and keep up with their visits, small cavities and gum infections can be caught early enough to avoid large expenses in the future from major restorative procedures. A lot of major restorative procedures, which include things like root canals, extractions, crowns, deep cleanings, are left alone because so many people have anxiety when having to do these. When left alone, things only get worse from here. If people were to go every 6 months, there would hardly be the need for these major procedures, as the teeth and gums would be taken care of before we even get to this stage. A clean mouth will lead to a happier you. Unfortunately, many people wait until a tooth starts to hurt to actually pay a visit to the dentist. Now, I've been working in the dental field for about 7 years now, and one thing I typically hear from people almost every day is this is too expensive. I get it, I really do, because in all honesty, it is. The cost for dental work can seem ridiculous. But if you were to have been coming to the dentist regularly, you would have never been in this place, right? That tooth that now needs a root canal and crown at one point was simply a small cavity. On top of all this, I believe dental insurance should be a requirement. There should be a penalty for not having dental insurance, just like there's one for not having medical insurance. This may encourage people in going to their dentist more often as well. At the end of the day, dental care is just as important as medical care. There are many benefits when visiting your dentist every 6 months. Did you know that dentists can even identify whether you may be diabetic or at risk for diabetes? The Life Science staff wrote an article in 2013 which provides information about a research done at Columbia University. This research showed that dentists have a 92% chance of accurately diagnosing diabetes. Periodontal disease is an early complication of diabetes, but dental providers have other approaches to identify diabetes in the dental care setting. Another great benefit comes to those who deal with sleep apnea. Dentists can provide a customized mouth guard to open their airway and eliminate snoring for people with sleep apnea. They can even help determine whether you may have sleep apnea if you are unaware. The lack of dental care in community should be a concern to all. We need to take our dental health just as serious as our medical health. Why is it that if we are told we have a condition such as high blood pressure, we'll take care of it and approach it more seriously? But if we are told we have gingivitis or periodontitis, we may not act as quickly. We need to do a better job in taking care of our oral health to protect our overall physical, mental, and emotional health. This is why I urged that you visit your dentist biannually. And if you don't have a dentist, now is a great time to begin looking for one.